Pediatric hospitals in crisis mode tonight, inundated with young patients. Doctors are calling it a perfect storm of surging viruses, RSV, COVID, and the flu. Jenny, you spoke with a doctor who confirms many hospitals are overrun.
Yes, I did. Good evening, Sheba. And also pharmacies like the one here behind me have been busy too. But the doctor tells us that they are preparing for this surge to last until April. But they're hoping, of course, that's not the case.
We are in a crisis right now.
Virtua Health Systems in South Jersey says it's been overwhelmed with patients for the last month.
We are seeing sometimes between 120 and 140 patients per day. Typically at this time of year, we're seeing somewhere in the 50 to 65 patients per day range. We don't have enough physical space to see all of those patients. And so we're doing our best.
Slammed hospitals means longer wait times. Dr. Jeff Seiden, medical director for pediatric services at Virtua Health Systems, says they're looking to turn waiting areas into makeshift hospital rooms because of such high demand, with staff members and urgent care centers working overtime.
While we continue to have more staff coming in, there's a limit on how much staff we have.
One viewer sent this picture of an urgent care center in King of Prussia with a line wrapped around the building 30 minutes before the doors open. Why the sudden surge?
Really, it was an early onset of the RSV season that initiated this surge. And now we're seeing that compounded by the initiation of the influenza A viral surge.
Plus, COVID-19 infections holding steady. Dr. Seiden says in many cases, upper respiratory infections should be treated and monitored from home. However, parents should seek emergency care if you notice a child is struggling to breathe.
If you're a young child or a baby, you will often see pulling in around the ribs. You'll see children using their abdominal muscles a lot more to breathe.
Also, seek emergency care if they're unable to stay hydrated. Hospital staff throughout our area are asking for people's patience and understanding as they deal with this brutal wave of pediatric illness.
From the medical side, we are all making sacrifices in order to care for the children of our community.
It's definitely scary for all parents out there. So the big indicator that your child needs emergency care is difficulty breathing. So if their chest sinks in, if their coloring changes, and also if they're not staying hydrated. If you are treating your child at home for any kids that are ages 1 and older, Dr. Seiden suggests a teaspoon of honey before bed. He says it can do wonders for that cough. Back to you.
Some great advice here, very helpful to parents. Jenny, thank you.